During the night shift, when the power went out at Memorial Hospital, 28 critical patients were cut off from life support. When the backup generator also failed, while other nurses panicked, Sophia Laurent did something different. The way she moved through the dark corridors, it wasn't something a normal nurse was used to at all, as if she had worked before without electricity, with limited resources, in much worse conditions. "Sophia, how can you stay so calm?" asked Dr. Alexander Beaumont, watching her mysterious behavior. "Experience," Sophia replied, but that experience didn't come from ordinary places at all. What Sophia did in the next 12 minutes would reveal a secret she had kept hidden for 15 years, because her hands moved like someone who had treated wounded under enemy fire. Welcome to Hidden Legends. Before we continue with this powerful story, tell us in the comments which city you're watching from. And if you believe stories like this deserve to be told, hit that subscribe and like button, please. Sophia Laurent had been working as an ICU nurse at Memorial Hospital for 11 years. At 41, she was reliable, always preferring the night shift. Together with Dr. Alexander Beaumont, nurse coordinator Isabel Moreau, and other nurses, they provided care to 12 to 15 critical patients daily. "Sophia is our most dependable nurse on the shift," said ICU Director Dr. Beaumont. "Perfect coordination in emergencies, complete control even in complex cases. Patients and families find peace in her presence." But Sophia's extraordinary calmness and precise intervention ability came from a much deeper and different background than ordinary hospital experiences. Her routine as an ICU nurse was always the same. Shift started at 8 p.m., ended at 8 a.m. Cardiac arrest, respiratory failure, multiple organ failure, post-operative complications, standard ICU cases. Sophia remained calm and effective in every situation. Isabel found Sophia's behavior during emergency situations different. "Sophia, how do you stay so organized during critical moments?" she would ask. "Experience," Sophia would say quietly. "There should be a procedure for every situation." This experience came from a 12-year career as an Army Field Surgeon Assistant, Advanced Life Support and Combat Zone Medical Operations, Mass Casualty Management, Emergency Surgery Assistance in hostile environments. Sophia had conducted medical operations in the world's most dangerous places. Sophia Laurent's real story began 23 years ago. She had joined the military at 18. In her childhood in Los Angeles, Sophia had witnessed emergency medical response. "I want to save people in chaos," she had told the military recruiter. After basic training, Sophia received Medical Corps, then Advanced Individual Training, eventually Field Surgical Team Selection. She showed exceptional physical and mental performance. She was selected for 68-watt Field Surgeon Assistant Specialized Training. Army Field Surgeon Assistant Training was the military's most demanding medical education. Advanced surgical procedures, battlefield medicine, mass casualty protocols, extreme environment medical operations. Sophia ranked in the top 3% among female candidates. Her first deployment: forward surgical team support, combat wounded treatment, evacuation medical care. During 2.5 years of deployment, she conducted over 80 critical surgical assistance operations. Her second deployment: urban combat medical support, IED blast aftermath care, mass casualty incident coordination. Sophia's specialization was medical precision and resource management under extreme pressure. Her third deployment: classified operations on the Syria border, special forces medical support, high-risk extraction medical coverage, covert operation medical assistance. Sophia's most challenging and dangerous medical missions occurred during this period. Sophia's Army training wasn't just medical. Advanced surgical assistance, battlefield trauma management, resource allocation under extreme pressure, medical leadership in chaos, specialized competencies. "A field surgeon assistant must be a complete medical professional," said training instructor Major Felix Schultz. "Operating room technician, trauma specialist, medical coordinator, life-saving assistance in extreme conditions." Sophia had mastered this comprehensive approach: combat zone surgical procedures, maximum medical effectiveness with limited equipment, decision-making in high-stress medical environments. Her medical knowledge was much more advanced than a registered nurse. The most critical training was mass casualty, surgical support, multiple trauma cases, overwhelmed medical facilities, resource scarcity scenarios. Sophia learned to provide surgical assistance to 15 to 20 wounded soldiers simultaneously. She had specifically received field surgical emergency training operating room setup in hostile environments, surgical instrument management under fire, anesthesia assistance in primitive conditions. These skills would be incredibly applicable in Sophia's civilian hospital work. After 12 years of military service, Sophia made the decision to transition to civilian life, combat stress symptoms, desire for family life, commitment to peaceful medical service. She transitioned to the healthcare sector. "Why are you leaving the Army?" her field medical commander had asked. "Because I want to continue medical service in a civilian environment." Same dedication, different setting. During nursing education, Sophia was significantly overqualified, advanced surgical knowledge, emergency medical experience, crisis management skills, but educators hadn't inquired about her detailed military background. "I've always wanted to serve in healthcare," Sophia had said, helping people in critical times. ICU nursing was an ideal match. Hospital protocols felt familiar to Sophia: medical emergency response, critical care decisions, team coordination under pressure. When Memorial Hospital hired her, Sophia was an outstanding employee: clinical expertise, crisis composure, advanced medical capabilities, but nobody suspected her extraordinary military medical background. On Friday night, the 8th of March, Sophia was on her normal night shift with Dr. Beaumont and the team. They had provided care to 6 routine cases: post-operative monitoring, respiratory support, cardiac rehabilitation, neurological assessment, infection management, pain control, standard ICU operations. The shift was proceeding peacefully, normal patient status monitoring. By 11:15 p.m., most patients were in stable condition, routine medical care continuing. "Quiet evening, Sophia," said Isabel, updating patient documentation. "Winter storm forecast, but hospital system stable, everything normal." "Weather conditions can be unpredictable," said Sophia. "Emergency preparedness is always important." This caution came from 12 years of military medical experience. In combat zones, unexpected situations were always the most dangerous. At 11:47 p.m., the hospital electrical system suddenly failed. The winter storm had overwhelmed the external power grid. Main electricity completely cut off. Immediate darkness enveloped the hospital ICU, but the backup generator automatically activated. Emergency power systems continuing normal operations. "Standard power outage protocol," announced Dr. Beaumont. "Backup generator functional. All systems maintained." Sophia immediately went to alert status, military training, automatically engaged, power infrastructure, vulnerability assessment, emergency resource evaluation, patient priority determination. "Isabel, check emergency equipment status. Verify extra battery supplies. Confirm manual ventilation devices accessible." Isabel was surprised by Sophia's immediate, comprehensive emergency preparations. "Sophia, this is a routine power outage. Backup generator working perfectly. Always prepare for secondary failures," said Sophia, her movements with military precision. At 11:49 p.m., the backup generator experienced sudden mechanical failure. The hospital ICU went into total electrical power loss, complete silence, ventilators stopping, monitors going dark, life support systems suddenly inactive, only emergency battery lighting providing minimal illumination. Panic immediately erupted: nurses screaming, patients gasping, family members shouting, medical equipment alarms silent but critical. Sophia evaluated the situation, and her military medical training fully activated. "Dr. Beaumont," Sophia's voice cut through the chaos with authority, "we need to implement immediate resource allocation protocol. Patient survival requires a systematic approach." Dr. Beaumont looked at Sophia with a shocked expression. "Sophia, what's your recommendation?" "Manual life support implementation, priority-based patient classification, resource distribution for maximum efficiency." Sophia started patient assessment before official authorization. Her command presence was immediately evident: critical respiratory failure patients, priority 1. Manual ventilation required immediately. Cardiac monitoring patients, priority 2. Stable patients, priority 3. Staff automatically began following Sophia's directions. Her systematic approach was reducing the panic. Sophia ran through the dark corridor and reached the first patient. 8-year-old Mr. Theodore Harrington was completely dependent on the ventilator. The moment the machine stopped, his lungs stopped working, pulse oxygen level dropping. Isabel shouted in panic. Sophia knelt beside the patient. Harrington's lips had turned blue, his eyes rolled back, minutes from death. Manual resuscitation bag. Sophia's voice was determined. When her hands grasped the bag, she was at the field hospital in Kandahar under bombardment. No electricity, just hands and experience. 1, 2, 3. Sophia squeezed the bag rhythmically. Harrington's chest rose, fell, rose, fell. Pulse coming back, Isabel shouted in amazement. But Sophia didn't stop because 6 meters away, 3-year-old Emily Sinclair was having a heart attack. Isabel continued Harrington's ventilation. I'm checking on Emily. Sophia ran to Emily. When she reached her, the young woman was having convulsions, her heart beating irregularly, unable to breathe. Vib, where's the defibrillator? Sophia found the manual defibrillator in the darkness. Sophia, battery level very low. Maybe one shock possible, said Dr. Beaumont anxiously. Sophia checked Emily's pulse, very weak, irregular. Her heart could stop in a minute. Clear. Sophia placed the paddles on Emily's chest. Everyone back. Electric shock. Emily's body jumped. The monitor was silent. Then beep, 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 normal sinus rhythm. Dr. Beaumont watched in disbelief. But Sophia's work wasn't finished. At the end of the corridor, she could hear calls for help. Sophia ran to the other end. 4 or 5-year-old Thomas Whitaker, admitted for monitoring on the 3rd day after heart surgery, was now lying on the floor, unconscious. Whitaker, Whitaker. Sophia knelt beside the patient. No pulse, no breathing, lips turned blue, post-operative cardiac arrest. Sophia quickly diagnosed. His heart stopped after surgery. She started CPR in the darkness, chest compressions, strong and rhythmic. Whitaker had survived surgery. He could overcome this crisis too. 1, 2, 3. Sophia counted the compressions. Whitaker's chest was rising and falling. 15, 16, 17. Sweating, but not breaking rhythm. 30. Sophia paused for ventilation, giving 2 strong breaths into Whitaker's mouth. 2 minutes passed, no change. 3 minutes, Whitaker still wasn't responding. Cyanosis deepening further. Sophia, too much time has passed, Isabel whispered. Maybe we lost him? No, Sophia continued. He survived heart surgery. He'll survive this too. 4 minutes. Sophia's arms began to cramp, but she wasn't giving up. 5 minutes. Suddenly, Whitaker's chest rose on its own. He coughed. Thomas, can you hear me? Sophia checked. Sophia, is that you? Whitaker opened his eyes, spoke hoarsely. Yes, you're safe. Stay calm. Sophia was out of breath. Just then, Dr. Beaumont's voice came from the end of the corridor. Sophia, Mrs. Victoria Langford, respiratory arrest. Sophia turned. 5 8-year-old Victoria Langford, a chronic lung patient, couldn't breathe without the ventilator. She was starting to turn blue. Sophia ran to Victoria. Cyanosis had progressed. Oxygen level dropped to critical levels. Manual ventilation bag. Sophia took the bag, placed it in Victoria's mouth. 1, 2, 3. She squeezed rhythmically. Victoria's chest rose, fell. Pulse. Oxygen rising. 65%, 70%. Isabel was monitoring. Sophia performed manual ventilation for 4 minutes, her hands cramping but not stopping. 80%, 85%, approaching normal levels, Isabel shouted hopefully. Victoria opened her eyes, looked at Sophia. Gracias, she whispered. Just then, the hospital electricity came back. Lights turned on, ventilators started working, monitors began beeping. Sophia stood up, wiped her hands on her pants. In 12 minutes, she had saved 5 people's lives. She hadn't done anything like this, even in the field hospital. Sophia, said Dr. Beaumont admiringly. How did you do this? Sophia looked around, 28 patients, 27 alive. They had only lost 8 9-year-old Mrs. Eleanor Forsyth. Her elderly heart couldn't withstand it. Experience, she said quietly, but now she didn't have to hide where that experience came from. You're both right, said Sophia. Normal nursing training doesn't teach these procedures. Dr. Beaumont and Isabel were listening intently. I'm a former Army field surgeon assistant. Staff Sergeant Sophia Laurent, retired, 12 years military medical service, 5 deployments, 3 major combat zones. Complete stunned silence in the ICU. Other medical staff nearby heard, and medical procedures momentarily paused. Army Field Surgeon Assistant, said Dr. Beaumont with amazement. You were a military surgical specialist. 12 years battlefield surgical assistance, mass casualty medical support, extreme environment medical operations, trauma surgical procedures. Sophia continued patient care while providing explanation. Every medical intervention was perfect precision. Every assessment professional competency. Why are you doing civilian nursing with an advanced surgical background? Sophia's facial expression became serious. In 2018, on an operation in Syria, a refugee medical facility was bombed. 34 civilians, 18 children. We couldn't save everyone. Profound silence. After that experience, I decided to apply my medical expertise in a peaceful civilian environment to protect innocent people, serve families. Over the next 12 minutes, Sophia achieved extraordinary medical management. All 28 patients were stabilized, received appropriate emergency care, life-threatening situations resolved. Critical respiratory patients maintained manual ventilation. Cardiac patients continued monitoring. Stable patients assured comfort. Most impressive was the systematic organization. Sophia's resource allocation ensured optimal patient care. Staff coordination was excellent. Emergency protocols perfectly executed. Sophia, this emergency management is exceptional, said Dr. Beaumont, completing final patient assessments. 0 patient casualties. All received appropriate emergency medical care. Team coordination, said Sophia modestly. Team coordination? You independently organized a complex emergency medical response. Under standard hospital protocols, multiple patient losses would have been probable. Medical staff surrounded Sophia with obvious respect and admiration in their expressions. The following day, hospital administration learned of Sophia's military background. An emergency administrative meeting was convened. Sophia, why did you never disclose your military medical experience? Asked Chief Medical Officer Dr. Edward Hawthorne. It wasn't relevant for the civilian nursing position. I serve as an ICU nurse. Not relevant? You have advanced surgical training, emergency medical expertise, crisis management experience, doctor? Hawthorne continued. Sophia, we want to offer you a promotion emergency medical coordinator, disaster preparedness specialist, trauma response supervisor. Sophia considered, I prefer direct patient care, hands-on medical service, immediate patient assistance, but your expertise could benefit the entire hospital training development, emergency protocol establishment, crisis preparedness, coordination. Sophia Laurent's story isn't about medical heroism. It's about the continuity of medical service dedication, peaceful application of professional expertise from Army Field Surgeon Assistant to ICU nursing, from battlefield medicine to civilian healthcare, from military medical operations to community hospital service, always providing medical service. Military provided systematic medical training. Civilian healthcare taught compassionate patient care. Both are essential for complete medical service. When hospital patients encounter Sophia, they feel medical confidence. Real medical professionals transform their forms of service, but healing dedication never diminishes. Sophia's medical commitment that night was a civilian application of Army medical training, military medical expertise, perfectly implemented in a hospital emergency. So I ask you, have you met military medical veterans quietly serving in your healthcare community? Hidden Army medical backgrounds silently contributing in civilian hospital care? Share your medical experiences in the comments, because at Hidden Legends, the greatest medical professionals often serve in the most critical healthcare roles. If this medical story moved you, share it, subscribe, and help these important military medical stories continue. We'll encounter you in the next medical legend. Remember, on your next hospital visit, emergency care, or medical treatment, you might encounter unaware military medical backgrounds. Real medical heroes change their forms of service, but the healing spirit remains eternal.